We are offering CME. Again, we don't use the chat, but use a um, email. You can see here, CME@dhs@maine.gov. And if one of my colleagues, again, could put that in the chat, that would be great. We have no financial relationships to disclose. This time around, we're going to focus on some important updates from the USCDC and talk about the next phase of vaccine distribution and prioritization with older adults, phase 1B. You've heard us talk several times about the various forms of vaccine that are both out there and in development, knowing that there are several different sort of groups, but the first focus has been on the 2 mRNA vaccines. Not a lot new with that, so just a reminder that they're very similar. The second dose dates are somewhat different at 21 and 28 days. Age is different. Cold storage is slightly different. But the new thing that we mentioned last week is that the viral vector vaccines are getting closer. Johnson & Johnson likely going to be presenting information from their clinical trials soon. We talked a little bit last time about the slightly different mechanism, similar sort of approach in terms of giving the cell. Actually, I saw a great, I have to put the link in a little bit, a great YouTube video from Northern Light Health about mRNA vaccines and how it's giving the body a recipe to make their own chocolate chip cookies so that you recognize the cookie next time you see it. So I'll put the link in that just a little bit. A couple of important updates that the US CDC has, it's interesting, they sort of quietly into their materials. One is that the second dose of vaccine, while they still recommend it at the time frames that have been out there, they recognize, I think, that this might be an issue with vaccine shortages and millions and millions of people now getting the doses. So recommend that earlier doses really should, we should avoid giving earlier doses. We should give it within 4 days of the recommended date. The second dose should be given as close to that as possible, but if that's not feasible, the second dose may be administered for up to 6 weeks or 42 days after the first dose. So that's a pretty significant change. And again, it's not recommending to stretch it out. And they note that data on the efficacy beyond that 6-week window is limited. Also, that if the second dose is administered beyond those intervals, there's no need to restart the series. But I think certainly could give people some peace of mind in terms of, if they're not able, or we know we haven't had much snow yet, but we know the inevitable snowstorm is going to come and cause, delays and cancellations. So one important update, and I put the link always to the USCDC site for full information. The second, and this is another big one, up until now, there's been sort of a hard line on should not interchange the 2 vaccines, that we should be making sure that Moderna gets Moderna, Pfizer gets Pfizer, and the US CDC is still saying that, but they note in exceptional situations in which the first dose product cannot be determined or is no longer available, any available mRNA vaccine may be administered at a minimum interval of 28 days between doses to complete the series. And you can see further here, if the 2 different doses, you don't give the additional dose of the original product, and they're saying recommendations might be updated as further information becomes available or other vaccine types come out. So again, pretty significant update. So just FYI, so again, not being recommended, not the standard practice, but should you hear of this, it is something that US CDC is now saying is acceptable. And then there was one more. Oh, just that this has come up in several previous sessions. What about autoimmune diseases, Guillain-Barré, Bell's palsy? So this is information, again, straight off of the US CDC website, which basically says none of these present conditions which should be considered to be a contraindication of the vaccine. Autoimmune, Guillain-Barré, or Bell's palsy should not be contraindications. There is no evidence, certainly as yet, that the vaccine, again, we've talked about this, causes autoimmune diseases. There's been no reported cases of Guillain-Barré with the mRNA. There have been several cases of Bell's palsy, but the FDA's opinion is that those are not above the expected frequency of that illness. I'm trying to struggle with the word is with that occurrence to be related to the vaccine. Another thing that came up, we mentioned this on the Friday version of this last week, Dr. C has noted that he's got several inquiries from individuals who develop a local reaction around 1 to 2 days post-vaccination with some pretty significant redness, swelling, itching, some pain at the injection site. And there's a couple of photos here of 2 different people. And so just wanted to note that this is not, it's not common, but it's also not unusual. It does not generally indicate an infection. It does not require antibiotics. It can last 7 or more days. So just be aware, reassure people, can treat it symptomatically with ice and cool compresses, but it's likely, and I believe Peggy Penoyer is on. Peggy, do you want to talk a little bit more about the understood immunologic basis of this?
I think this is just a normal post-vaccine response, really. I mean, you'll see this with people who get pneumococcal vaccine boosters more. So I don't think there's anything alarming. You just look for something worrisome like necrosis or severe blistering. That would be something we'd want to have them contact the CDC helpline or something. But these are normal, and we just need to reassure people cold compresses, try to avoid oral steroids.
Great, thank you. And then also wanted to note, and Amy Madden, you're going to jump in and talk about older adults. So you're the one who flagged this as a resource. Do you want to talk a little bit about this? Because I know you actually use this service from the USCDC to request consultation on complex safety questions. Do you want to jump in,
Yes.
Amy?
Yeah, thanks. Right. So this is a clinical consultation service that's offered by the CDC as in regards to vaccines. You know, they're looking for questions or concerns that don't appear to be addressed readily in the current ACIP or CDC materials. And one of our nurse practitioners who practices at Ann Arbor used this service. They got back to her within 5 days. It was excellent. So anyways, I would encourage I would encourage folks to use it. We actually asked the question about the delayed reaction that we had seen, that several folks have seen at the vaccination site, and they just, reinforced that Maine was giving accurate information already. So,
Great,
good resource.
Great. So I'm going to talk just a little bit about the phases, and then I'll turn it back to Amy to talk about considerations with older adults. You again are probably all aware, but we've been solidly in phase 1A for the past, month or so. Healthcare personnel, residents of long-term care facilities. The governor, 2 weeks ago now, added public safety, fire, EMS, rescue, police, and state level personnel who are considered critical to the state's COVID response. And then just this week, with some vaccination sites opening up last week, older adults, 70 and older. The way this has been presented in press releases and the website, I think some people have read this as, well, isn't this everybody? Aren't we in 1B as everybody? But I just wanted to emphasize, no, the emphasis right now, the plan is to really focus on greater than 70 years old, because there are a lot of people in that category. I believe I heard the number 190,000 estimated. And because of the escalated risk of death with age, older age, we really want to focus on that. A lot of people have asked, well, what about high-risk medical conditions? And there's agreement they can also be at risk, but the state's approach right now is the 70 and older. There's also, I understand, a front page article in the Portland Press Herald today about a drive-through site for people with intellectual and developmental disabilities. I believe that was supposed to be for individuals who live in residents and staff and long-term care facilities and group homes, that they are supposed to be people in 1A. I understand that may have been interpreted a little bit more widely, but because I know you'll get your patients asking, but truly we are still on the 70 and older, and the hope is to march through those. And we know it's not a precise science. We know it's not exact. It's not a surgical approach. And, we hear about occasionally people, getting it sooner, but that is the intent, again, because of the risk of age. Just a couple of screenshots that the information is kept updated on the governor's website for COVID vaccine. I'm going to update my screenshot. That number is above 100,000 now. And then if you scroll down that page, where to get a vaccination or how to get a vaccination, the link will bring you to this list, which now has about 40 sites on it. So thanks to all of you working in hospitals and communities and other sites offering vaccination. Most of these sites, really all but 2 of the private practices, are open to the public. So if you're hearing stories, well, they're only taking their own patients, please contact me. That's not supposed to be the case. And they should all now have a phone number because we know not everybody can get, not all older adults can navigate the website. So with that and recognizing the focus on 70 and older crowd, I'm going to turn it to a real clinician who's seeing these patients every day, Amy Madden, to talk about her approach and considerations when vaccinating older adults.
Sure. Thanks, Lisa. Amy Madden, I'm the medical director for HealthReach, and in my clinical role, I am practicing geriatrician, which I would just say that anybody who's doing primary care in the state of Maine is also a practicing geriatrician. So, for vaccinating older adults, obviously the messaging that we're using, because it's true, is that the vaccines are both safe and effective. And of course, the adverse outcomes, highest risks are in this population, as we all know. I saw Elizabeth Thalmann talking about vaccine confidence. This is a group that's got a lot of vaccine confidence, as we know anecdotally. This is not the group that I think we're seeing a lot of the flip side of folks that are not vaccine confident. I really appreciate that language. However, I think the important thing to think about in the older adult population is to consider this idea that avoiding other vaccinations 2 weeks prior to receiving the COVID-19 vaccine. This has been one of those challenging things for me because timing is challenging in a rural area. A lot of my folks are not able to get to the vaccination clinics, so we're sort of trying to figure out other options, and you're sort of trying to figure out timing and juggling when they should get the other vaccines. But obviously the clear and present risk right now is with COVID-19, so prioritizing those, not getting the vaccine if feeling ill, and then obviously if you've had a previous severe allergic reaction, carry an EpiPen, that consulting prior to that. Just like you would in any setting when you're working with older adults, is you have to think about some of the mobility issues, different sensory issues, whether it's hearing or visual impairment, and things take extra time. That's that's my day. Just even getting folks from the car into the building can often take some time. So just having that in mind if you're thinking about throughput. The incidence of the post-vaccine symptoms, as we've seen in previous education, older adults actually tend to have a less of those side effects. So more present in younger adults. There may be, however, the need for additional potential supports. So being aware that you could have muscle aches and chills and fever, things that might affect how an older adult is able to care for themselves at home, and having a way to address those. One of the biggest things I think in a really vaccine confident population is to really address the things that need to continue to happen even after receiving the vaccine, right? There's such hope here for folks to be able to be with their families and, sort of go into the community without having so much anxiety. But we still need to emphasize the role of all the really important measures of masking, social distancing, and hand washing. That the time of getting together and being with others is going to be there, but there's a continued need for us until we have more information about the spread of the virus, and also in addition to that, just our own vulnerability in older adults in the phase 4 to continuing to have people use masking and distancing, et cetera.
Great. So actually, just one more thing on the older adults. Amy, you're well aware of these conversations, but I suspect it will come up. So, we've heard concerns about, gosh, how are older adults supposed to navigate the system, get into these large-scale vaccine clinics that are starting to open up versus primary care. And I think there are some very good ongoing conversations with primary care groups about that, and really trying to balance the state's strategy to date of really velocity and efficiency, getting as many shots into arms versus the realities of, some older adults are just not going to either go or be able to go to large scale clinics. And how do we best utilize the primary care community to help with this as well? So don't have final answers yet, but there are absolutely ongoing conversations. We appreciate Amy's leadership and the MMA, MOA, Primary Care Association, and hope to have more on that soon. So we do, again, share resources, a bunch of links here. We post always to the CDC website. Always happy to answer questions. And with that, I'm going to stop sharing and bring it to the questions. So because I haven't been able to monitor the chat, Amy, any questions that are
they wanted you to show again the slide with the consultation phone number, Lisa, if you want to pull that back up.
Sure, yeah. Um,
Some questions
and
around eligibility while you're pulling that up. Why are some hospitals allowing workers who are home-based to get vaccines?
workers who are home-based. Yeah, so that's not not ideal, but again, I go back to it's messy, it's not a precise science, right? So when the ACIP criteria first came out, Advisory Committee on Immunization Practices, it was clear that healthcare personnel was very broadly defined, and we initially split it up into groups 1, 2, and 3. Group 1 was the most acute care, front-facing. 2 was other healthcare personnel, but still front-facing, and 3 was supportive infrastructure. And that was the initial approach. I think, through stories around the country of, academics who were never ever going to see a patient and maybe weren't so critical to the infrastructure of the organization being vaccinated, the governor pulled back on that and said, no, we really want to focus on front facing. But by that point, there were a lot of horses out of barns. And I think the intention has always been to follow those guidelines. But, at that point, it became a little bit more directive in terms of, no, we really should be focusing on front facing. But, it's again, this strategy of as many vaccines as possible also meant don't leave clinic seats open if there are people who can come and get it and the Moderna is going to go bad or the Pfizer is going to, warm up. Right. So I think we just have to ask for everybody's patience and forbearance and know everybody's trying to do the best job possible. Are there going to be some bad actors who try to cut the line? Yes. But generally, I think the intention, has been good, and everybody's trying to do the best they can. So this is the slide, and I will copy and paste the phone. Whoops, that's not good. So I should not do things as I go here. Copy and paste the information into the chat as well in terms of the request information. And Amy, which one?
Really around eligibility. So non-residents, has Maine changed its stance on vaccinating non-residents? Do they have to be here a certain amount of time to get a vaccine?
The last I saw from Dr. Shaw last week was they had not changed their stance on that, because his argument is because vaccine is allocated to the state on a population basis, residents of the state, that it really should be people who are residents of the state. So
New
there's not.
Hampshire, before New Hampshire was saying that they would do non-residents, but they changed their stance last night to say they were only going to do residents. And I think we'll see that just the vaccine supply is so limited right now.
It's also been this issue, this wacky issue of medical tourism, right, where people are traveling to other states. I mean, it's one thing for somebody to live on the border and having to navigate that, and there's probably some reasonable cases. It's another thing for people to be driving 6 hours or 12 hours just to a state because they're allowing non-residents. So I think they want to avoid that as well.
Is there any plan to make the sign up for the vaccine coordinated at the state level? Many of my older patients are finding it challenging to navigate the multiple site and lack of clarity on how to sign up, how to secure an appointment online.
Oh boy, Amy, you want to take that one?
I think the state is currently, the Maine CDC is currently looking at a platform to try to make it easier to sign up online. They've been talking to a company and they hope to roll this out. I think what they've seen in other states, though, even with the best intentions with these online platforms, they can get overwhelmed with just the sheer volume and number of people trying to sign up online. So that is something that the Maine CDC is hoping to roll out. But some of this is just a supply and demand issue at this point. And so they're trying to figure out the best way to do that. I do know that for some of the older patients, the state is talking to some of the agencies like the AAAs and some other groups to try to figure out ways to assist older Mainers in getting appointments. And so that conversation is ongoing right now.
Okay.
There's a question about time to avoid other vaccines. What is the timing? And I know, Peggy, you answered that was 14 days to avoid other vaccines within 14 days. Do you want to talk to that, Peggy?
Yes, I think that's just what I just copied that right off the CDC latest recommendations. And so I think that just gives us a good window. No data that I am aware of. So just that's the recommendation, 14 days as a minimum before other types.
there any information on post-vaccine symptoms to share with residents? I think they're looking
Yeah.
for sort of a handout for families.
I've seen pretty good information on the USCDC site, so let me see if I can find that and chat that in. I also saw a question early on about CME, unrelated to the clinical issues here, but do you have to email them every time? And the answer is yes, because they're tracking, the total number of sessions in terms of your CME hours. Otherwise, they wouldn't know. So yes, send a quick note each time you attend a session.
Are older adults able to bring a support person to vaccination sites? I'm not sure if we have folks on the line from some of the sites to let us know what your policy is. I know we're trying to limit the number of people in the sites.
Deb Silverstein, and I'm involved in Maine Health vaccine clinics, and people are able to come with loved ones or caretakers or whatever to get their vaccine at the Maine Health ones.
Thanks.
I can speak to.
Some facilities are saying vaccines only available for patients 80 and up. I'm suspecting that's just because of the limited amount of supply that location may be getting. The state guidance is you could do 70 and up, but I think it really depends. Some sites are only getting 100 doses of vaccine in a week. They're not getting thousands, they're getting small amounts, and they're trying to kind of do people by category. And that may be why one facility says 80 and up, one is doing 70 and up. Lisa, do you want to add more?
Yeah, I
to
think you're
that?
completely right, Amy. I've heard that as well. So some, physician practices, particularly who are doing this, that serve just, huge numbers of older adults, had to do something to prioritize or felt that they, should. Again, we know that death is directly related to older age. And so it's just their own internal prioritization, trying to get the most vulnerable first. So the category, you're right, is 70 and older, but if the practice needs to prioritize that makes complete sense. And again, we will get to everybody, right? It's a lot of over and over patience and persistence. On a related note, I'm seeing a question, Intermed, saying they vaccinate only their own patients. Can they do that? So right now, yes. So there's two sites on the governor's site, I mentioned, of 40 that are doing their own patients. That's Intermed and Martins Point. They have been allowed to do that right now because they serve such a large number, and they're not just really set up like one of the other, large scale vaccination sites. So yeah, yes, for right now. And again, just trying to make the most efficient
The other
distribution.
thing about Intermed, and I'll say just kudos to them, is that they have really done a lot of work to get the 1A healthcare providers in the southern Maine area. They've taken on a lot of groups that were unaffiliated and really helped out getting that group. And I think they continue to have a wait list on that. So not only are they doing their own patients on the public facing side, but these groups are also helping to get the 1A healthcare provider groups, especially those that are not in large health systems. And so they've taken on that role, and we have appreciated all the work they're doing in that area. So just so people are aware of that.
Yes, thank you, Amy, for pointing that out. Yep.
So what happened to VSafe? CVS told us at our clinic we did not have to have people register.
So that, nothing has happened to it. I'm not sure why CVS would have said that. It is still out there. I saw that somebody put the link to it. That is great. So it's really an optional thing that vaccinating sites, ideally should encourage people to use, because it's an automated way for them to get a regular check-in on symptoms and to track, adverse reactions. I don't know. We can ask our CDC folks to check with CVS about why. I'm guessing that was a misunderstanding or miscommunication, but it's very much still out there.
This might be for Dr. Penoy. Is it recommended that people take Tylenol and Benadryl prior to the second vaccine, or really pre-medication? What's the recommendation for vaccines?
We shouldn't pre-medicate currently based on what we know about this. And one of the worries is if you take an antihistamine in preparation, you might mask early warning symptoms of an anaphylaxis. You want to be observing these people for 15 or 30 minutes based on their clinical history. And you want to be able to recognize that somebody is having an allergic problem earlier rather than later. So you might hide hives or other early warning symptoms. So don't pre-medicate is the current recommendation, except in rare circumstances.
Thank you, Peggy. Another question around, moving into next phases around high-risk medical conditions, has the state determined what's going to be in the high-risk medical conditions list based on the federal CDC list?
Not yet. So we certainly are paying a lot of attention to that, looking closely at that CDC list, what other states are doing. I think the concern is we don't want to put too much focus on that yet because of that 190,000 people in the 70 and above, and then we've even got 65 to 69 under that. So we are looking at it, but it's not been determined yet. I mean, if you look around, every other state pretty much follows the USCDC guidance with some exceptions. There's some question about some of the diagnoses in there are quite prevalent. So if you include the whole list, it's quite a large group, and others argue for, some conditions that don't have a lot of evidence, but are known to be otherwise high risk for serious illness. So coming soon, but not yet.
If a person gets an appointment, how likely is it they'll be canceled due to limited vaccine? What happens if they get canceled? Do they move to the end of the line?
I have not heard yet. I think everybody's concerned about the limited vaccine supply, and that certainly is always a risk of large sites being, having to cancel days. I've not heard that has had to happen much yet, and I think it really depends on the individual site. I don't know. I'd certainly welcome anybody, Deb Silverstein, I want to put you on the spot, or others who are associated with some of these larger sites, what your approach has been in terms of anticipating vaccine supply and how people get scheduled, but I suspect it varies place to place.
Yeah, it's my understanding from a Maine health perspective, although I really would need to defer to pharmacy who's managing it all, but that they match so that they know that they'll have the second dose if the person got the first dose. But I don't have a lot more detail than that on it.
Mm-hmm.
I haven't heard of any problem with cancellations on because it's not available for the second.
I think what Northern Light has done is they're releasing on Mondays. They find out how much vaccine they're getting, and they're only releasing the number of appointments for the vaccines that they know that they're getting in the pipeline. And that's one of the reasons why a lot of these groups will close their registration or say, we're done for the week. It's just because they're trying to only schedule out for the vaccines that they know are coming. And I know that can be frustrating for people.
Yeah.
A lot of questions around kind of second dose side effects. People are finding that the second dose, people are having a lot more side effects than the first. And just talking about how to manage that with work schedules and medications.
Yeah, so I don't know, Peggy, if you want to jump in there. The reality is we do have that data, from the clinical trials, and it's not, the numbers are not insignificant on second dose. I don't have the link right here, but if somebody wants to email me, I have from Steve Sears the actual full report of the prevalence of those side effects. But I don't think that really argues still for the pre-medication. But Peggy, do you want to?
Again, yeah, no data for pre-medication. And again, you really don't want to mask early recognition of a problem by using an antihistamine. And there's no data that's going to help because these are a different kind of response. It's a healthy, beneficial immune response to the vaccine. I warn people as I'm giving them their second dose and head them out saying, it's going to be great. It will, every ache and chill you get is a wonderful thing. So.
Excellent, Peggy. All right. Well, with that, we are at the end of the hour. So thank you all for, or half hour, I should say, all for joining. Again, feel free always to email me if you're running into issues. Letourneau@maine.gov. It's pretty straightforward. And I put in, oops, there's an error. There's a U at the end. My own name. That's great. Yay. And we'll be back on Friday again with focus on the similar info, and then again next Tuesday. If anybody has suggestions for other topics they want to hear about, feel free to email those or put those in the chat as well. Thanks so much. Thank you, Amy, Peg, and everybody for jumping in today.